So again, please mute your line versus putting it on hold. Also, if you could submit your questions via the webinar chat feature, that would be great. And we will address as many questions as we can at the end of today's webinar. We'll also provide a Q&A online for folks that weren't available to attend this session. And we will record this session, as you just heard, and make it available on our website in a couple of days for, again, folks that weren't able to attend. So quickly, I want to just take a minute and review the agenda. We're going to spend a few minutes talking about the Maine Health Data Organization's reporting requirements and just give everybody a reminder of what Compare Maine is. And then we'll do a review of the updates to Compare Maine that are in this upcoming release that we're referring to as 2.0. And then we want to spend some time reviewing the payment data spreadsheets. We want to allow 20 minutes, at least 20 minutes, for some Q&A at the end. And then we will close by reviewing the timeline and next steps. So just quickly, as a reminder, the Maine Health Data Organization and the Maine Quality Forum are both independent state agencies that are governed by two separate boards of directors. And both of these organizations are required in their governing statutes to collaborate in promoting the transparency of healthcare costs and quality information via a publicly accessible website. In the fall of 2015, we launched Compare Maine, which is our publicly accessible website where we are posting healthcare costs and quality information. As a reminder, the website was developed with stakeholder input, including a MHDO consumer advisory group. It integrates cost information with 3 quality measures where available, and those measures include patient experience, serious complications, and healthcare-associated infections. The site allows for the comparison of costs for 206 procedures by facility, and we define costs as the average total payment. There are 162 facility groupings comprising about 237 facilities currently, which include hospitals, surgical centers, diagnostic imaging centers, labs, and clinics. And as many of you know, this information is available by the top 5 health insurance companies in the state. So that would be Aetna, Anthem, Cigna, Harvard, and Community Health Options. And then there's the option to look at this data for all insurance companies that submit claims data to the MHDO. As a reminder, costs represent the total professional and facility payments when applicable. The categories of procedures that we're currently reporting on include office visits, physical and occupational therapy, integrative medicine, mental and behavioral health services, OB/GYN services, radiology and imaging, lab services, and some surgical procedures. In most cases, Compare Maine reports the cost for a single procedure. However, there are some surgical and diagnostic procedures that involve a main procedure and several related services. And again, as a reminder, there are a little over 11, I think maybe 12 surgical procedures where we are using a grouper, and we use the medical episode grouper. Many of you are probably familiar with this. It's called the MEG by Truven Analytics to create groupings of claims based on clinically based logic. And we list the procedures where we are using the grouper. And we are, and you'll hear from Margaret Mulcahy in a few minutes from HSRI on some of the enhancements that we're making as part of our 2.0 launch. And one of those enhancements are we have, I think, improved the language that describes the MEG and how the MEG works as it relates to looking at severity. And so that's something we can certainly talk more about or follow up with people individually if you're interested in that. So with that, I'm going to turn things over to Margaret, who will walk us through the next part of the agenda, which is focusing on the updates that we're making as part of this 2.0 launch. And then Margaret will review the payment data spreadsheets that we will be forwarding to you all this week. And so with that, Margaret, I'll turn it over to you.
Great. Thanks, Karen Lee. And thank you, everybody, for taking the time to join us this afternoon. Karen Lee mentioned we have a couple items we want to draw your attention to that will be new or enhanced for the 2.0 version of Compare Maine. The first is the more detailed facility and payer review spreadsheets, which we'll be reviewing shortly. We have more recent data, more facilities, more procedures, and an enhanced search functionality. And I'll be going into each of these in a little more detail. So one thing we have done is we have enhanced the methodology for producing cost estimates. In particular, we've revised the methodology for physical therapy and occupational therapy to calculate a unit cost for each CPT code, which is different than how we were previously reporting that data. We've also added several new procedures, including 2 colonoscopy codes, 3 digital mammograms, and about 10 additional high-volume labs. We have added 8 new facilities to the site, and we will be updating the quality measures when those data sources become available later this month. And as I mentioned, we improved the within-site search function, so it's easier for users to find the procedure or the facility they're looking for. We have better search terms, and also we've improved the search engine optimization to better direct users to the site. So if they're Googling Compare Maine or cost of hip replacement in Maine, we've worked on driving that traffic towards the website. This slide is an overview of the procedures that are currently on Compare Maine and what we are adding for 2.0. So the first one, as I mentioned, is diagnostic procedures. We're adding those 2 colonoscopy codes. We're very excited to be able to do that. And you can see the 10 new labs we've brought in. Also, depending on data volume, we're hoping to bring in a few more mental health procedures, a few more office visits, and PT and OT, and radiology. So that's you will see all those procedures in your spreadsheets. Well, the list of procedures in your spreadsheets. Not every facility will have data for every procedure. And we're keeping the 8 surgical procedures on the website the same. I just wanted to take a moment to review our methodology. This is available on the spreadsheet itself and in more consumer-friendly language on the website itself. What we're going to be presenting you with is claims data received by MHDO from October 1st, 2014 through September 30th, 2015. And you can see here the sort of 7 high-level steps we take to create our analysis set. So first, we remove incomplete patient encounters without cost data. In this version of 2.0, we are excluding public payers, and because of that, we also exclude claims for those who are 65 years and older, because oftentimes those individuals have sort of dual coverage, so we want to make sure the data is clean. We then attribute the claim to the procedure of interest and to the provider using the provider NPI. We calculate a median total paid amount, which includes contributions from both the insurer and the insured. And then we add that insurance filter to the data so users can filter to see costs by the top 5 payers in the state or to see all payers averaged together. And lastly, we create a summary statewide row that displays the median cost for the particular procedure at the state level. I'm just going to give a quick overview of what you can expect in your individualized spreadsheet, and then I'll walk you through a sample version of one. The first page is important. It's the cover page. It explains each tab. We have a methodology page which explains how the costs were calculated, and as I mentioned, this is also available on Compare Maine itself. You'll see the procedure list. So this would be the list of all the CPT codes that we are providing cost data for that will hopefully appear on 2.0. As I noted previously, not all facilities or payers will have data for all procedures. And this is obviously due to certain providers not offering different services. And also, you may offer a service that does not show up for your organization if it was filtered out by our criteria. So that's important to take a look at the cover page if you have questions about that. Another really important tab, particularly for the facilities, is the list of included NPIs. This is how we're generating your cost data. So we've gathered these through communication with facilities, also through NPPES. And we just really would like you to pay careful attention to that tab to make sure we have the correct NPIs and facility names for your organization. And for payers, this would be a list of all the facilities that received payments from your organization for which we have claims data. Facilities will also give you an address tab. This will have the contact information for your facility as it will be displayed on the website. So if there have been any recent changes to telephone or fax numbers, any physical location changes, it's important to let us know that so we can provide the users with your most up-to-date contact information. Lastly, we'll have the cost data tabs. For facilities, you'll have 6 tabs, one for each of the 5 payers, and then one overall tab. And this will allow you to see how the different payments are breaking down across those payers for the different procedures. And payers obviously will only have one tab where all their data will be aggregated. Lastly, we have the feedback tab. This should be familiar to those of you who gave us feedback in previous iterations. This is just for us to ask you some specific questions about your data. Gives you an opportunity to give us general feedback and also just confirm your contact information or provide contact information of a new contact. And right now I'm going to open up one of our spreadsheets. So here, I'll try and make it a little bigger. So here, as I mentioned previously, this is sort of your cover page, your table of contents, and it explains the what information you can find on the different tabs. This is the review of our methodology that we discussed previously. And, very important to note that the count that we're including for you, that is included for your reference only. We're not going to be publishing that on the website because the count is the number of analyzed claims. It will not match the number actually performed by your facility due to the analysis criteria that I mentioned previously, including excluding public payers, those over 65. So just please keep that in mind. wanted to highlight that for the labs, if the lab is a blood lab, it automatically is going to include a draw code, and where appropriate, it will include a transportation code. And imaging procedures, this is important too. We bring together both the technical and professional components of the procedure so that we capture the whole payment. We know that sometimes the technical and professional components are performed by different facilities, and what we do in that case is we attribute the total cost to the facility with the highest payment, even if they didn't provide both services, and that typically ends up being the facility where the image was taken. Our next tab is the methodology tab. It's here for your reference if you have any questions about how certain numbers were calculated or how we get our data. You can reference this. Our procedure list includes the procedure type and subtype. This is how users will find these procedures on the website. We've included the CPT code and the CPT code description. The included NPIs tab will be filled out with this information. So here you'll see the NPI number, the facility name, and if the facility is listed by any other name in NPPES. And up here, the reporting name is how we will display your name on the website. So sometimes facilities are followed by an LLC or a PA. So just please pay attention to this cell for reporting name to make sure that's how you would like to see it on the website. The address tab is pretty explanatory. Some of the facilities we have rolled up smaller departments or facilities into one bigger entity. This is often the case for hospitals or larger organizations. So what you see under main address will be what is searchable to the consumer, and then when they click on that main address detail will be the information about all the facilities that were rolled up to calculate costs for your organization. The cost data tab, as I mentioned, for facilities, these will be separated out by insurance provider. And what you'll see here is the main category that the procedure falls in, the CPT code, the description of the procedure, the count, and again, as referenced below here in row 17, the count is the number of analyzed claims, so that will most likely be lower than your actual claims submitted to MHDO. Then what we have is the median total cost of the procedure or the episode. And what we're doing a little differently this time is to help facilities understand the costs for imaging procedures or surgical procedures where there might be more than one facility involved. What we're going to have here is percent payments to the lead facility. So if you have a row, for example, for hip replacement, that means you are the lead facility. So in this case, roughly 68% of the payments for the hip replacement were made to the lead facility, and we'll give you that dollar amount in the next column. And then we'll also show you the percent payments, the dollar payments made to other facilities and or professionals. So we really wanted to make sure to include this for this round of review to help facilities have a better understanding of their portion of the payments. And lastly, we have the feedback tab. This should look fairly familiar. Just let us know who reviewed it, their contact information, and then if you could please answer the questions about the ways in which we're presenting your data and whether or not, given the analysis criteria, that the cost and volume estimates seem accurate. And lastly, we have a box down here if there's anything else you have concerns or questions about. You can fill that out, and also if you would like us to contact you regarding your feedback. So I realize that was a lot of information, so we're going to pause now to see if there are any questions. You can use the chat feature to ask us questions. Also, if you would prefer to ask a question offline, you can feel free to email the email address listed here on this slide.
And so, Margaret, maybe while we're waiting for questions, let's talk about the timeline. Because
Okay, let me move to that slide. Yep.
That may generate some questions. So the law requires that the information on our publicly accessible website be updated 2 times a year. And so one of the things that we talked about when we initially were working on the launch of Compare Maine was getting you all a schedule for when those updates will occur so people can sort of build that into their calendars. And so that's something we will be following up with you on. But that's primarily why we are updating the site, is we need to update the cost information as required to by the law. And the other thing that, we've said and we very much believe is that this website is still a work in progress and we'll continue to refine it. A number of the updates that we're making as part of our 2.0 release are based on feedback that we've either received from many of you on the phone or talking with folks, whether it be individuals representing physical therapy, for an example, and or talking with consumers. We got a lot of feedback from folks that were visiting the website that the number one procedure that we were missing was colonoscopies. So that's part of why we are going to be including colonoscopies in this next release. So with that said, our thinking around the timing is that after this call, over the next couple of days, we will be sending out emails with your individualized cost spreadsheets. And what we're going to do differently this time versus the first launch is we're also going to include with that spreadsheet access to a password-protected version of Compare Maine that has all of the updates in it. So I think sometimes when you can put this information into context, it helps with the review versus just seeing it all in the spreadsheet. So we're going to include both these pieces of information for you, again, before the end of this week. What we are requesting is that by May 2nd, that you submit any written feedback to us using the feedback tab that Margaret just reviewed. And we will, obviously, as that feedback comes in, we'll start reaching out to you to address it. So in our own internal planning, we're saying that we'll be working on responding to feedback that we receive through May 13th. And again, our goal is to launch 2.0 by the 1st of June. And the one note I just throw out there is feedback that we get after May 2nd, we may not be able to incorporate into the June release. So just to highlight, it would be great if you've got feedback to get it to us before May 2nd. Margaret, do we have any questions that have come through?
I think we just had one question about the slides being made available after this webinar, and those will be posted on the website.
So, Margaret, correct me if I'm wrong, but we're going to post the slides. We'll post the slide deck. We will post an audio of this webinar. And
yep, the recording.
And what, am I missing anything, or is that?
And the timeline will be posted.
Okay. Are there any questions? I know there are lots of people on the phone. That's why we're kind of suggesting people use the chat feature. But if anybody wants to ask a question, please feel free to do that.
It looks like we don't have any further questions.
This is going to be the fastest webinar ever. I don't want to hold people up. I know you're all super busy, so unless anybody has a question that they want to ask verbally, I think we can end this session, and we look forward to getting you all the updated information and these updates that we're making, and look forward to working with you as you review the spreadsheets. So with that, thank you, everybody, and have a great rest of the day.
Thank you. Bye.